Good evening, everyone. I'm Dr. Miller. I'm one of the ears, nose, and throat doctors at Cape Cod Ears, Nose, and Throat Specialists in Hyannis. And so tonight we're going to talk about obstructive sleep apnea and specifically focusing on Inspire therapy. At the conclusion of the presentation, we will address questions from the audience. So to submit a question, just enter it at any time in the Zoom chat window, and we'll review them all at the end. All right. I have no disclosures. And so I am required to read this. So this meeting is being recorded while speakers, myself, will take questions from the audience. We ask that you do not share specific details about your case or ask questions that seek a diagnosis or treatment. Rather, your questions should be about the indications, risks, and benefits for Inspire therapy. Talking to the speaker does not replace medical care. The speakers are providing only general information and are not providing you with personalized medical or healthcare services or advice. Please be aware that you are electing to ask the questions in a public forum over a platform that is not HIPAA compliant, and accordingly, any information that you provide about yourself during the meeting will no longer be private. Okay, now that we're through with that, we'll review briefly what obstructive sleep apnea is. So when we sleep, our airway, muscles, and tongue normally relax. For people with sleep apnea, the tongue relaxes in a way or into a position that can block the airway, limiting airflow and oxygen into the lungs. And so when your airway is blocked, you get less oxygen to your brain, which triggers you to wake up to take a breath. And this cycle happens repeatedly throughout the night, which can prevent quality of sleep. There are several consequences of untreated sleep apnea. We often think of brain and heart health, and so patients with untreated sleep apnea are at increased risk for things like stroke, sudden cardiac death, high blood pressure, ischemic heart disease, and heart arrhythmias. Not surprisingly, patients with untreated sleep apnea have more fatigue and diminished productivity, and they're also at a 2.5 times increased risk of driving accidents. And many of you may experience this, but the snoring and pauses in breathing at night can lead to bed partner separation. And so the first line and best treatment for many patients is CPAP, which is continuous positive airway pressure. Many of you may be being treated with this at the current moment, but this is delivered via a full face mask or nasal pillow, and it's continuous positive pressure at the same level when you breathe in and breathe out at night. If CPAP is not right for you, there are other options. And so alternative treatment options include things like behavioral modifications, which include things like weight loss, avoiding sedatives and alcohol, or positional therapies, mainly trying to avoid sleeping on the back. There are oral appliances or mandibular repositioning devices, and these are better for patients who are snorers or people snore without sleep apnea, or patients with mild sleep apnea. And these are custom dentist-made mouthpieces intended to pull the lower jaw forward during sleep to help relieve obstruction. And there are all other anatomy-altering surgeries, which can be quite invasive. They can make parts of the jaw larger or move the tongue forward or create more room in the throat. And what we're all here for tonight is Inspire. So this is a newer treatment option. It was FDA approved in 2014. And so it's an implantable device that works inside the body. And when it's turned on at night, it senses your breathing. And so when you breathe in, it delivers a gentle pulse or stimulation to your tongue to move forward or protrude forward, which helps relieve the obstruction. And so you can see in the image, there's a remote control. So patients actually turn the device on before going to bed. And about 30 minutes later, it'll kick on. This allows you time to fall asleep before receiving any stimulation to the tongue. There's a little sensing lead on the chest, and so when it senses that you take a breath in, it senses a gentle pulse or stimulation to the nerve that moves your tongue, and that will bring the tongue forward to help relieve the obstruction. The surgery itself takes about 1.5 to 2 hours. The device is inserted through 2 incisions, one on the right chest and one in the right upper neck. The recovery is not terrible. We ask people to avoid strenuous activity for up to 4 weeks, but within a few days, you can return to non-strenuous activity. And it's not terribly painful. Generally, pain is controlled with over-the-counter medications and not narcotics. The battery lasts for about 11 years. If the battery needs to be changed, we simply access it through the right chest incision. Again, that would be another surgery or operation, but much quicker and shorter. And again, just access through the one incision on the right chest. And the good thing about Inspire is it is MRI safe and compatible. And so this just gives us a different viewpoint of where the implant sits in the body. So you can see on the right chest, it would be really just over the pec muscle. You have the Inspire implant with the battery and the breathing sensor, and it's then connected up into the right upper neck via a wire, and that is connected to the nerve that moves your tongue on the right side. And so again, when it senses your breathing at night, when you breathe in, it'll provide that gentle stimulation to the tongue nerve, which then moves the tongue forward and allows air to pass through the airway and into the lungs. There are various qualifications and requirements in order to get this approved by your insurance company. So patients must be 18 years or older. You must have moderate to severe sleep apnea. So patients with mild sleep apnea are not, unfortunately, included in this. Most insurance companies require a sleep study to be done within 2 years of initial consultation. Most insurance companies are completely fine with home sleep studies, which is very convenient. Only United requires an in-lab sleep study. And so we also must document that you've tried CPAP and have failed using it or are intolerant of it. And it can be intolerance for any reason, whether it's uncomfortable, you rip it off at night, you're claustrophobic. We just need to document that you've tried it. And it doesn't need to be for a certain time period. Even if you've tried it, I would say for a month and tried a different mask or two, that's adequate trial. And so if you've returned your CPAP machine, that's fine. That meets our requirement. Various insurances have different BMI requirements. So your BMI is a measure of your weight adjusted for your height. And so depending on your insurance, you might need a BMI of 32 or lower. Some allow up to 40 though, and that's a conversation that we could always have at the initial consultation. If you meet criteria based on the sleep study done within 2 years and tried and failed CPAP, and the BMI is within the right range for your insurance company, the next thing we would do is something called a drug-induced sleep endoscopy or DISE. And so this is a brief airway evaluation under sedation in the operating room. So we would schedule you for that procedure. Again, you would come to the hospital, get some sedation similar to what you would receive for a colonoscopy. And while you're sleeping and snoring, I evaluate your airway with a small camera to make sure that where your airway collapses is appropriate for the implant. And so just to kind of review what the order of events would be, because there are several steps in order to get approved and make sure you're a good candidate. One would be the initial consultation with me. Two, we would get an updated sleep study if needed, if we didn't have one within 2 years, and then discuss weight loss if needed. Again, if we met the criteria based on the sleep study and weight, then we'd schedule you for the drug-induced sleep endoscopy, that brief airway exam under anesthesia. And if that checks out, then we schedule you for the implant. Again, the implant surgery is about 1.5 hours to 2 hours. You go home the same day. I would see you 1 week after surgery for a wound check. And then 1 month after surgery, the device actually gets turned on and activated. And that's when you're taught how to actually use the device. And then there's some fine tuning thereafter. And about 4 months after surgery or 3 months after it's activated, we'd have you do a sleep study with one of our Inspire representatives present to do some fine tuning if needed. And so we have fairly good data to support the efficacy of this device. Patients overall have, fairly good or fairly satisfied with it. So overall satisfaction rate of 90%, and 91% of Inspire users rated it as better than CPAP. And when we look at average use per night, patients on Inspire therapy use it for on average 5.7 hours compared to just 4.5 hours with CPAP use. And by spring of 2022, over 25,000 patients have undergone the implant. It's an incredibly safe procedure. Over 99% are successfully completed without any major complications. This just shows the efficacy of the device. So for 5-year data, patients had an average of, when we're looking at sleep apnea events per hour, before Inspire, they had 29 events per hour. After Inspire or the implant, it was down to 6. And when partners were asked about snoring, well, not surprisingly, there was significant improvement or reduction in snoring. And so just some other key takeaways. This device will only treat sleep apnea and not other sleep disorders or issues such as insomnia or frequent nighttime awakenings from other things. Keep in mind, it is a real surgery that requires some recovery and downtime. And it's not going to work perfectly immediately. It does require some practice and patience and getting used to. Most insurances will cover it as long as we meet their requirements. We won't perform the implant unless we know it's being covered by your insurance company. And here's just some information about the Inspire Sleep app. So you can download it to your smartphone, learn a bit more about how Inspire works, watch some short videos that can answer common questions, or connect with people who've undergone Inspire to get kind of what their real-world, real-life experience has been. And so now we can certainly take some questions. Thank you. Okay, so first question is, what would disqualify a person from getting Inspire? One would be mild sleep apnea. We wouldn't be able to get that approved. It wouldn't be indicated. Two would be if we couldn't get your BMI, your body mass index, into an appropriate range that your insurance company would approve. Three, when I talked about that drug-induced sleep endoscopy, that airway evaluation, there's one type of airway collapse that would prohibit us from proceeding with Inspire. We see that in less than 5% of cases. And so as long as the sleep study numbers look good and the BMI is okay, most patients end up being pretty good candidates for it. Okay, so another question, good question. Does Medicare cover costs if I've been using CPAP successfully for years? It would be basically a conversation between the patient and myself to determine maybe what's been going on with CPAP, why aren't we tolerating it, if we've tolerated it in the past successfully, or if we're just looking for a different option. It's certainly something that we can document as shared decision making, that we're looking for a different option for treatment of sleep apnea. I will say, if patients are able to treat their sleep apnea successfully with CPAP, that is our standard of care. It's the least invasive option. And so although I'm a surgeon, I would generally go for the least invasive option. And so if you're successfully treating your sleep apnea with CPAP and you're doing well with it, I would probably stick with that. However, there are many patients who are just sick of CPAP, don't want to travel with it, et cetera, et cetera. So it'd just be a discussion between the provider and yourself to determine, how this could qualify as CPAP intolerance or failure. But generally, as long as you meet the other requirements, Medicare will cover it. Okay. Common Inspire side effects. So as I discussed, the risks associated with surgery are minimal. You might have some discomfort after surgery. You could always have some swelling along the incisions, some temporary tongue weakness on the right side where we do the implant. Other common side effects are actually a tethering feeling. So as you saw from the images, the implant sits in the right chest and there's a wire that connects up to the right neck. We leave enough slack so it doesn't, feel too taut or tight. And we have patients do neck rolls after surgery to keep it nice and loose. But sometimes people will still notice the wire under the skin, and it might feel like a tethering effect, but I would say that's generally temporary. Um, the other common side effects are if patients wake up at night for other reasons, and they forget to pause the device or turn it off temporarily. The device doesn't know that you're awake, and so it will still stimulate your tongue when you're breathing and awake, and that is quite uncomfortable. It can be uncomfortable or just a funny feeling. Um, when people are when the device is first activated, um, the stimulation might be a bit much to get used to and might wake them up from sleep. So in that case, we'll decrease the threshold for a short period of time until they become accustomed to it, and then we increase the levels thereafter as tolerated. Okay. Yes. So, are there types of sleep apnea not responsive to Inspire? Yes, that's a very good question. Um, so, Inspire is indicated only for obstructive sleep apnea, again, which is a sleep apnea caused by soft tissue collapse in the airway. There's another type of sleep apnea called central sleep apnea, where your brain is not telling you to breathe at night. And we would pick up on that, on the difference between the two on your sleep study. And so, actually, one requirement that we look for on the sleep study is that there are less than 25% central or mixed apnea events. So, it's primarily what we're looking for is primarily obstructive events. So, if it's your brain not telling you to breathe at night, Inspire won't work. Okay, how many devices have been implanted at Cape Cod Healthcare? So I want to say we're probably around the 15 number, 12 to 15. And so we started implanting last December. And so it's just been taking time to kind of build up the numbers. But we're probably at the 12 to 15. Can you feel the stimulation? Occasionally, yes, and especially during that initial buildup phase, you'll feel sometimes a funny sensation on the back of the tongue, and it might wake you up from sleep. And so, like I said, there is a buildup phase after initial activation. You start at a very low level and try to work your way up every week. However, if the buildup seems too quick, we bring you down one level and kind of wait a week or two, let the nerve and the tongue become accustomed to it, and then start building you up again. But most people are tolerating it quite good. Okay. Do I have to stop blood thinners to have the implant? Yes, before any invasive surgery or procedure, we need to hold blood thinners, and depending on which blood thinner you're on, your primary care doctor, your whoever prescribes your blood thinner would tell you how long, but it could range, generally on average 48 hours before surgery. And after surgery, I have people start their blood thinners the following day. Yes, this is another good question. What constitutes intolerance if someone has used a CPAP for over 15 years? Um, Not using the CPAP machine for 4 hours every night, or if based on the data from your CPAP machine, your sleep apnea was still over the mild sleep apnea range, if that makes sense. So there's certain numbers that we look at. Um, Alternatively, I feel we can make a case for patients who've been faithful with their CPAP to treat their sleep apnea, but just want a different option because they're sick of traveling with their CPAP, wearing a mask every night, um, have lines on their face from the straps, just uncomfortable from wearing the device. So I feel that we can make a case, and certainly we've implanted patients who have used CPAP successfully, but need a different option due to discomfort and that sort of thing. And certainly, one of our reps is on, and she can send chats or send responses in the chat box, so keep an eye out for that. But Megan, if you have any other insight or input for that, let me know. Yes. So are you able to participate in sports after recovery? So once you're fully covered, we don't have any activity restrictions. You'll just want to be careful with kind of getting bumped on the chest because it just might be uncomfortable, but it shouldn't do anything to the implant. But once you're past that 4-week recovery mark, you should be fine. What is the maximum BMI for Medicare patients? It would be a BMI of 35 or less. Is the procedure performed at your clinic? So the procedure's performed at the hospital, which is just down the street from the clinic. So again, it's an outpatient surgical procedure. So we do all of those surgeries in the operating rooms at the hospital. Okay. Are cardiac patients able to use Inspire? Yes, we would always, any patient with some type of cardiac history who sees a cardiologist, we would make sure they're cleared by their cardiologist before undergoing general anesthesia or surgery. We implant the device, our Inspire device, on the right side because oftentimes if patients need a pacemaker, it goes on the left side. So we leave that territory open for the cardiologists. Patients, if God forbid you needed a defibrillator, you can still use a defibrillator with the Inspire in place. So yes, cardiac patients can get Inspire. Is there a risk of infection at the surgical site? There's always a small risk of infection with any surgery or any implantable device. You would receive some antibiotics before surgery, and we're very careful with our surgical technique. So theoretically, always a risk of infection, but knock on wood, we don't see that yet or very often at all. Does one need to be cautious about sunbathing given the surgical site? For sunbathing, with any scar, I would recommend avoidance of sun exposure for 6 to 12 months after to avoid darkening or hyperpigmentation of the scar. Yes, I would be cautious with sunbathing. I would use a high SPF 50 or higher, and or wear, a wide brim hat that would cover the right neck and the right chest incision. Okay. Do I go through my PCP or contact your office directly? It depends on your insurance if you need a referral. You certainly can try to call our office first to see if you need a referral. And so that's a fine way to start. And then if they say, you need PCP referral, then go through your PCP. But certainly can contact our office directly to try to set up an initial consultation. And they'll let you know based on your insurance if you need to go through the PCP. Does a device set off metal detectors at the airport? No, it should not. You're safe to go through metal detectors, and it shouldn't set them off. And Megan, again, if I'm misspeaking on any of those, please clarify. But from what I've read, the metal detector shouldn't be an issue. Okay, where can I have a sleep study done outside the home? Is this available in the Hyannis area? So if we are not doing a home sleep study, then we'll do what we call an in-lab sleep study, and we send our patients to Falmouth Hospital. They have a sleep lab there. So that's where we send all of our in-lab sleep studies. Would either a PCP or a sleep specialist refer a patient to you? Either could. No right or wrong, but yep, either can. Does not have to be a sleep specialist. How do you monitor the efficacy for each patient? Really, one of the main ways is by doing that post-operative, post-activation sleep study. So once you're past that kind of buildup phase of increasing the stimulation to the tongue, and we do that sleep study around 3 months after the device has been turned on, that's how we can see how well we're treating your sleep apnea. And like I said, one Inspire rep will be there during the sleep study to fine tune things during the sleep study if needed. How long does a device last before needing to be replaced? So the battery life is about 11 years. So on average, 11 years before we need to kind of open up that right chest incision and replace the battery. Hopefully not before. Can the device fail? Yes, there's always a risk of device failure. At the time of surgery, before we close up the incisions, we have the Inspire representative in the operating room with us. And so we test the device before we close you up. We make sure the tongue is stimulating properly, and that the breathing patterns are appropriate, that the device is responding appropriately to your breathing pattern. And so uh, we'll make sure it's working before we close you up. But of course, certainly with any device, it could fail at some point. But again, I feel like the data um, doesn't show that that happens often. And again, look for any comments from Megan in the chat box to see if she has any other input. But it is key. We do test it to make sure it's functioning properly before you leave the operating room. Does your office provide CPAP? Yes and no. We, as ears, nose, and throat doctors, certainly can help people with obstructive sleep apnea. Um, we are not sleep medicine specialists. Dr. Ed Caldwell, who has been in our office for quite some time, is board certified in sleep medicine, but the rest of the providers are not. And so um, we will occasionally prescribe CPAP if it comes through our door, but it's not one of the main things that we see and treat. What is the efficacy of this device versus CPAP? So again, CPAP is kind of our gold standard of therapy. The efficacy is very similar. I don't have the numbers off the top of my head. Again, Megan might be able to put those in the chat, but the numbers are very, very similar for the implant versus CPAP in terms of treating and curing sleep apnea. And again, with the implant, for people who can't tolerate CPAP, they're able to use it for a longer period of time, and are a bit happier with it. But it shows fairly similar efficacy. Thank you guys. Thanks for joining.